San Blas, an archipelago off the Caribbean coast of Panama, is home to the Guna, a semi-autonomous indigenous people. The islands remain one of the few places in Central America that has not had a locally acquired case of dengue. On the island of Taquantaqui, through a long-standing relationship with Professor Sherry Porcelain from the University of Miami, the community requested an educational program about dengue prevention targeted at the youth. A team of University of Miami graduate students arrived in June 2014 to create awareness and provide innovative methods for mosquito prevention while addressing the threat of dengue in Panama.
Nosotros, como estamos, tenemos que tener un buen ambiente. Si nosotros contaminamos el ambiente, nos afecta muchas enfermedades.
Para evitar esas enfermedades, todos los tambuchos o tanques que tenemos alrededor de la casa, cuando llueve, al día siguiente se bota el agua, porque de ahí se reproducen los mosquitos.
Vector-borne diseases, such as dengue, caused by the mosquito Aedes aegypti, are becoming a growing threat. Environmental changes such as rapid urbanization, climate change, and increasing waste material contribute to growing risk factors for mosquito breeding. In addition, globalization has increased travel and allows vectors and their victims to spread the disease more quickly, placing 500 million people at risk. Latin America and the Caribbean have some of the highest rates of dengue. As of January 2014, the Ministry of Health of Panama has reported 2,906 cases of dengue and 6 deaths.
Para la isla sí es riesgo, sí es peligroso, porque la gente de aquí, personas de aquí siempre van a la costa y llegan, van y llegan, cuando se picó allá en la costa y llegan aquí y ahí comienzan a enfermar.
To raise awareness about mosquito breeding, the team used a card game developed by faculty from the University of Miami School of Communication called Humans vs. Mosquitoes, and adapted it to fit the cultural context of people living in San Blas. The game illustrated the relationship between mosquitoes, their breeding grounds, and how humans can contribute to or prevent the propagation of the mosquito larvae.
Para mí, pues, que es importante que los niños sepan, así los niños pueden comunicar a los padres o a los vecinos.
Los niños son los futuros de la comunidad, porque si nosotros no educamos a los niños, más tarde, ¿qué van a hacer? No van a pensar en su comunidad.
The game was supplemented by an educational talk. The talk was adapted from the prevention points developed for the Pan American Health Organization's initiative on World Health Day 2014. The youth participating in the activities discussed prevention techniques and learned about the signs and symptoms of dengue. It was evident that there were misconceptions, like not being able to distinguish between diseases and the vector. ¿Los qué? No! Sí! Afterward, the youth led a garbage cleanup to put their knowledge into practice and help with the growing trash buildup on the island. These public health activities help the youth connect the relationship between dengue and mosquitoes. Community health workers and health professionals must keep this in mind when developing awareness-raising or educational campaigns.
Ya los niños aprendieron algo de lo que no sabían.
Esa educación tiene que ser permanente, ¿no? Tiene que seguir hablando para que la comunidad sea consciente sobre eso.
While the awareness project seemed effective, the team did not have enough time to evaluate the retention of the information or if what the children were taught was diffused to other individuals on the island.
Nosotros tenemos que estar hablando para que por lo menos ellos entiendan, los jefes, los sailors, que tienen que tener conocimiento de eso y así si en esa epidemia ya por lo menos ya estemos alerta en eso.
Guna community leaders must continue to educate themselves and others so that the risk of dengue remains low. They face the complex challenge of encouraging their community to prevent a disease that seems unlikely to occur but is a serious threat.
Porque nosotros hablamos junto con el comité, junto con las escuelas, deporte, sailas, comuneros, escuelas, todo juntos nosotros trabajamos. Que si trabajamos así juntos, esas cosas tienen que malar y eso, nosotros cero se puede hacer.
No, agradezco a ustedes por estar compartiendo en ese tema muy importante. Es para prevenir, ¿no? Para no pasar mucha enfermedad.
There is no vaccine or cure for dengue. Education targeted toward primary prevention should be a priority in order to give the Guna the opportunity to live free of vector-borne diseases. and protect the islands they call home.
Sí, Mosquito.